Since the UN Secretary General launched Every Woman, Every Child in 2010, the business world has responded, understanding the importance of meeting the Millennium Development Goals. Companies around the world have made commitments to save the lives of women and children. But what can any one private sector company or partnership accomplish, you ask? You'd be amazed. Imagine a living laboratory that cultivates sustainable, evidence-based ways of improving maternal health. Well, you don't have to imagine. That Merck lab exists, and it will soon roll out a new medicine to prevent excessive bleeding in childbirth.
Maternal mortality is a multifactorial issue, and any multifactorial issue requires, by definition, a multisectorial solution. Very clearly, we realized early in the game that there is no one single sector, whether it be the public sector, the private sector, the civil society, governments, donors. No one sector can tackle this problem alone.
Or look to China, where Johnson & Johnson was an instrumental partner in creating the China National Resuscitation Program, which already has saved the lives of more than 90,000 babies. Whether we're providing affordable health insurance in places where few are covered, or training tens of thousands of frontline health workers on the proper treatment of childhood diarrhea, or bringing high-quality, low-cost infant care technology to rural areas.
These innovations speak about three things: simple interventions, strong partnerships, and leadership. And across GE and the GE Foundation, we use these principles to make sure that the impact we're having is scalable and sustainable around the globe and can really change health outcomes for every woman and every child.
Or teaching millions of children to better wash their hands and prevent the spread of disease. We're getting results.
What we found from this is a 25% reduction in diarrhea episodes. We saw 15% reduction in acute respiratory infection and a 40% improvement in school attendance.
It all starts with a single commitment, a moment of decision. We have done so much, but there is so much left to do.
Safaricom sees its mission as that of transforming lives. And in a country where there are fewer than 8,000 healthcare facilities or 2,000 doctors, but there are 30 million mobile phones, ICT has a critical role to play. And as the largest ICT company in the country, we have to take that responsibility seriously.
To build legacies that last longer than any company. Building on the successes so far, the business world will keep contributing beyond 2015 to the future development agenda, to keep saving the lives of women and children.
When you start to focus on improving both the health and education of women, all boats rise. At the same time, when you have such preventable death within large numbers of children, it's at our behest to actually do something about that.
You have the chance to change the world. Because a healthy world is a more stable world. Because promoting health is central to ending extreme poverty. Because together, we can do something great. Because to save every woman and every child, it will take every one of us.